My name is Dr. Victor Ortiz. I'm an orthopedic surgeon with a specialty in sports medicine and hip preservation surgery. My parents were psychologists, and that raised the interest of me on going to the medical field. I was born and raised in Puerto Rico. As a kid, I loved playing basketball. I tried to find a way for me to really be involved in the sport, and that's why after I decided to do med school, I wanted to go to orthopedics because we can really help the athletes get back to normal and I can still be involved in the sports. During my training, I did a lot of direct anterior approach and mako robotic assistance for total hip replacements. One of the biggest things that makes me very proud, I was able to really come out of my training, allow myself to keep doing robotic surgery to try to provide the best to my patients. Pain is a sign that your body is telling you there's something that is not right. And we have options. We go through the process of a conservative management that always is the first line of treatment. But when patients are to the point that, severe pain, I have tried everything. I think that's where the patient really becomes a perfect candidate for a hip or a knee replacement. When you see all the amazing things that you can do with the robot, how that reproduces to your outcomes, how that changes your surgical approach, you're convinced that you have to learn it because it's going to be great for your patient, it's going to be great for yourself. Hip is probably the most rewarding joint. Every time you come and you see a patient that is very happy, they were in pain and the surgery is done and they say, what happened here? The pain is gone. They are able to go back and play golf. They are able to go and play double tennis and go back to their activities they love without pain. The results, the patient feedback has been great. Right now, with all the technology that we have today that we're using at Kayal Orthopaedics, the outcomes keep getting better and better.